Well, in this week's Cardiology Countdown, we have two studies of imaging studies looking at cardiac resynchronization therapy and an interesting study of a novel lipid-lowering agent in a phase 2 study. So to begin with is a study of just 11 patients in JACC imaging that looked at novel diastolic function imaging modalities. This was echocardiographic particle imaging velocimetry that looked at the diastolic vortex and times to mitral opening, transmitral flow, and other cardiac timing intervals. And they looked at patients who had a CRT device and then when it was turned off, and found that there were worsening of all these various diastolic parameters, suggesting that cardiac resynchronization therapy not only would synchronize systole and lead to improved left ventricular function, but also have an impact on diastolic function as well. The second study was one in circ imaging that looked at an issue we recently discussed in another recent paper, that of scar being present at the place of the pacing leads for CRT devices. This was an interesting study that used a pre-imaging late gadolinium enhancement MRI study as well as a follow-up CT and serial echo. They looked at 66 patients and defined responders as those who had an improvement in the left ventricular ejection fraction by 15%, a standard definition, and then correlated the site of the implant of the left and right ventricular leads with presence of scar or not, and found that the response rate differed by whether the pacing lead was in viable myocardium or the scar. So in patients who had the leads placed in viable myocardium in both ventricles, the response rate was 81% and went down to just 55% and 25% respectively in there where there was an RV scar present or the lead in an LV scar, and 0% if the pacing leads were placed in both places where a scar was present. And so this is suggestive, as other studies have noted, that placing the pacing lead in the spot of a scar in these low ejection fraction patients really is a detriment in terms of response rate, and potentially avoiding that placement would help improve response. And the number one pick this week is a nicely done phase 2 dose ranging study of a novel lipid lowering agent. Now this is called ETC 1002, which modulates some new pathways of cholesterol management and fatty acid and carbohydrate metabolism. In this study, about 177 patients across 3 doses and placebo that was done stratified by baseline triglycerides, and they got 40, 80, or 120 milligrams of this new ETC 1002 agent. The LDL response showed a graded response of 18, 25, and 27% reductions in LDL across those 3 doses. And this was regardless of the baseline LDL or triglyceride level. There were similar reductions in ApoB and non-HDL, as well as LDL particle number. No changes in HDL or triglycerides, and some interesting trends on reductions in blood pressure, CRP, and fasting insulin, so some of the other cardiometabolic risk factors. And as such, this is a very interesting and promising new lipid modulating agent that could provide a non-statin mechanism of further lowering LDL. So for this week's Cardiology Countdown, I'm Chris Cannon.